Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard, you don't know where to go. Everything keeps falling apart, yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome back to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to have you back with us tonight. And we have a topic that's so important because it unfortunately leads to the loss of loved ones and is causing tremendous disease and medical havoc in the United States. And that has to do with cardiovascular disease, heart disease, stroke, heart attack, diabetes, coma, and something that seems so innocuous that when I first became a periodontist wasn't really that evident. Seemed like periodontal gum disease was something you could regulate or relegate to some side cabinet. It was not that important. It was just your smile. But as the years have gone by and we've done more and more research, we've seen that is not the case. So today we're going to be dealing with something very important, and I'll put it up on the screen for you, Buddha, and that's the interrelationship of inflammation, be it from periodontal causes, be it from diabetic or other causes, systemic causes, inflammation, heart disease, and diabetes. And this will be something that I feel will be very helpful, very important, really, to let your family members know and to get disseminated, to spread this information so that your loved ones can actually stay healthy and not end up being confused as to why they have a problem. So let's first start out with something very simple. And that's what I treat as a periodontal implant surgeon now for over 40 years. Periodontal disease, gum disease, causing bone loss. And interesting fact that actually is very, very high is that half of American adults suffer with some form of gum disease. Half of adults. And so when you think that we have approximately 330 million people, tremendous number of our citizens suffer from periodontal disease. From the Center for Disease Control, 1 out of every 2 Americans aged 30 and over has gum periodontal disease. And 65 and older, the prevalence increases to 70%. With periodontal gum disease. So somewhere a little under 160 million Americans suffering from periodontal gum disease. So as we start to elucidate this relationship with the periodontal disease, the diabetes, the cardiovascular and heart disease, the stroke, the heart attack. Let's first take a look at the warning signs of periodontal disease, which are many times overlooked. A bad breath or a bad taste in your mouth. Your gums are swollen or they're red. They're not comfortable. They're tender. Your teeth are sensitive. You chew, but it's not like it used to be. You really can't enjoy your food. Your teeth are not comfortable. And there's a tenderness in your mouth. And here you can see the inflammation existing between those two incisor teeth. The reddening of the gum from the inflammation that's occurring that we were talking about. Now realizing that that inflammation is going to be leading to medical problems. Leading not only to the bone loss, the recession of the teeth, oral problems, but now overall health problems. Here on this x-ray, in between those two same teeth, you see the darkening of the bone. That darkening of the bone is loss of bone. And so that loss of bone is coming from the bacteria which form tartar deposits that we call calculus. And they're infecting the gum, they're infecting the bone, and the body is retreating away from this disease process. There, highlighted, you see the area of destruction, the bone loss, where the conflict is occurring in your mouth. Let's go on to more signs and symptoms of gum periodontal disease. Obviously, as you lose the bone support, your teeth start loosening. As you lose the bone support, your gums start pulling away and receding. And as they start to pull away and recede, it's like taking off your coat in the middle of winter. Your teeth are sensitive. They're sensitive to cold. They're sensitive to sweet. They're sensitive to when you eat. Sometimes what starts occurring is that you'll notice that your teeth don't seem to mesh the way they used to. When you eat, you're not quite comfortable, and there's some change in the fit of your teeth. If you're wearing partial dentures, the dentures may not fit the same way. Here you see a picture of an advanced gum disease with a tremendous gum and bone loss, with the brown and darkened teeth. Why? Because there's accumulation of the tartar mineral deposits, the calculus deposits, the sensitive teeth. You can see the teeth are loose almost from looking at the picture. You don't even have to touch them to realize this person is not comfortable. This person is not happy. So, if this is what we want to avoid, then let's take a look at certain risk factors that we need to keep under control so that we keep this disease at bay. And if you can, Buddha, if you can bring me back to that slide, previous slide, that the risk factors, we'll go in reverse. And there we go. And these risk factors, number one, very important, smoking. Smoking causes 2 to 3 times more gum periodontal disease in each person. So the same person, one smokes, one doesn't, everything else the same, will have 2 to 3 times more disease, 2 to 3 times more chance of having more inflammation in their body. Second factor, diabetes. Diabetes and periodontal disease have been shown scientifically so many years now, so many journals, associated, almost correlated. Now they're starting to show correlations. And so it's very important to prevent diabetes, number one, and two, if you have it or you're pre-diabetic, to definitely control it to not allow you to develop or worsen your gum disease. Your hygiene is a risk factor. You may think that since you don't feel anything, there's no problem, but periodontal disease is not a painful disease. It doesn't cause pain normally until it gets more advanced, as I showed you. So if that's the case, you need to control this with your hygiene, with your brushing, and with your flossing daily. Stress levels. For those of us in New York, and maybe even all of America now, stress levels have increased dramatically. And stress leads to immune function decrease, leads to disease increase incidence. So we want to control our stresses. Heredity is something that you have genetically. You're not going to control that. But if you know that you have genetic predisposition, if you have a family history of many of your family members losing their teeth at an early age, ending up with dentures, by all means, please visit the dentist more frequently and get checked by your physician for diabetes, your blood sugar. Teeth that are malposed are going to cause problems because of the accumulation of debris. Underlying immune problems. Sometimes it's AIDS, which is very severe, but other times maybe, arthritis, osteoarthritis, or some type of arthritic condition, or myalgia, can cause different problems of immunity and inflammation, which then again can worsen your periodontal disease. And some of the medications that we take to control the arthritis, because they're immune modulating medications, can affect your periodontal disease, just as some high blood pressure or hypertensive medications can affect your periodontal disease, cause inflammation, cause redundant and growth of your gum tissues. Fillings that have become loose, fillings that are defective, bridges that don't fit well, all of these things lead to more plaque accumulation and periodontal disease. So what we want to do is we want to control that. And two important things I want to reiterate: smoking. You want to avoid smoking. Obesity. You want to avoid overeating, getting overweight, because that's going to increase your periodontal disease, increase your inflammation, increase your disease state. There you see the bone loss that comes about from the severe periodontal disease. This was actually published in major magazine across the whole country, Time, about the silent killer. The silent killer they were talking about was gum disease, because people were thinking, well, it's just my teeth, or, well, it's not that important. But it was silently leading to diabetes and heart disease. So let's take a look at this. There you see it in a diagram, the tooth on the left, those deposits that look like a little cement, the calculus deposits, the bacterial plaque, and then on the right, the gum. And the little holes you see are ulcerations. There you see the ulcerations. And the gum starts bleeding, it becomes inflamed, and the infection progresses into your body, and now you've got inflammation in the mouth going systemically throughout your body. Something very important is that inflammation can affect not only your mouth and your gum tissues, but it can affect your heart, it can affect rheumatoid arthritis, it can affect asthma, diabetes, obesity, so many different diseases. Obviously, heart disease, stroke. Again, this being published in Time magazine. So let's take a look at a Harvard study of diabetes and cardiovascular disease. Heart disease, obviously, is the leading cause of death in our country. And diabetes is the strongest risk factor for that very heart disease, with a 2 to 3-fold increased incidence of heart disease when you have diabetes. And cardiovascular disease, which leads to heart attack, stroke, is the most frequent cause of death in men and women with diabetes. And adults with diabetes are 2 to 4 times more likely to die from heart disease. So diabetics have an increased level of low-grade inflammation of their arteries and vessels, and that initiates heart disease. Now, let's go further with this interrelationship of the gum disease, of the diabetes, of the heart disease, through these inflammatory factors. And let's take a look at the outcomes. So, dental infection is definitely associated with coronary atherosclerosis. In fact, the bacterial plaque, the germs, their DNA is found in the plaques in the blood vessels, which are called the atherosclerotic plaques. That DNA from the mouth bacteria is found in your vessel plaque. And what is this related to? Dental infection, gum periodontal infection. The dental atherosclerosis risk and community study showed the relationship between periodontal infection and atherosclerotic heart disease. Why was this? Again, due to infection-mediated inflammation. And there's a high prevalence of heart disease and gum disease in individuals with diabetes. Again, why? Due to the same factor, the inflammatory factor increase in the body. Here you have a diagram. It's a little bit complicated, but there's a total burden of infection. And in those little white squares, you see different names of bacteria. These are very destructive, aggressive bacteria which love to grow in inflamed tissue, which has a low oxygen level. And they cause inflammation, which you see in the black square. And on the side, you see how mental stress increases the inflammation. You see how smoking increases the inflammation. And you see how some autoimmune diseases and their medications can affect inflammation. And so what happens is then you have from that inflammation down, you see the diabetes, you see the atherosclerosis, the heart disease, and it's not just a one-way street. So it's not just the inflammation causing the diseases, but then the diseases themselves then causing destructive consequences, leading back up to more inflammation, which can also go back into the mouth in reverse, which I see very often in my office after over 40 years as a periodontal dental implant surgeon. That what happens is in the patients that I treat with diabetes, invariably and almost inevitably, they develop some sort of flare-up. And there's really no reason in their mouth, but their diabetes is going out of control. So the important of this diagram, the important factor is to realize, see your physician, follow the recommendations on controlling your diabetes, eating properly, the exercise, see your dentist or periodontal surgeon specialist like me, and make sure that you're getting examined, you're following our recommendations, and that you're making sure you keep your mouth healthy. Now, let's talk about some good news. Up to now, all this negativity, all these fears, all these things to worry about. Let's be proactive. And I love to be proactive. I like to be positive with my patients. Because remember, we talked about decreasing stress. So part of stress is feeling out of control, feeling like you can't do anything about it. But there are things we can do about it. So increased heart disease begins years before the diabetes is diagnosed. What does that mean to you? That if it hasn't been diagnosed, don't just sit back on your couch and say, I'll continue to eat these potato chips and these brownies. No. It's time to control your diet. It's time to go take a walk. Maybe go to the gym. More than 60 million Americans are at risk for developing diabetes. So, if you want to prevent heart disease, if your family has a history of heart attack in their 50s, 60s, if you really want to avoid the genetics that's in your family, prevent yourself from getting diabetic in the first place, and treat your gum disease. Visit your dental professional. Some other factors, very important, we mentioned obesity. So if you can moderately reduce your weight, that's going to help you. If you start controlling your nutrition, that's going to help you. It doesn't have to happen all in 1 week. You can take time with it. 30 minutes of exercise 5 times a day is fine. Maybe it's just walking. Maybe you go to the gym. Maybe it's yoga. But some form of exercise, 30 minutes, 5 times a week. This reduces type 2 diabetes more than 50%. Diabetes is associated with increased oxidative stress. What does that mean, increased oxidative stress? Well, that means that diabetes causes a chemical process in your body, and it reflects in a subtle injury to body tissues over time. And these injuries cause, you guessed it, inflammatory factors that come out in your blood, come out in your body, causing more diabetes, causing more disease, heart disease, osteoarthritis, periodontal disease, obesity, and all the things we've mentioned. Because of that, and because it causes this oxidative stress, there are certain things you can do. Vitamin E and vitamin C are very good. Also, vitamin B complex is very good. Beta carotene, which is basically colorful food. What is colorful food? Fruits and vegetables, rich in fiber, fruits and vegetables that are green, orange, red. You want to pick colors because the more color they have, broccoli, spinach, eggplant, the more they're going to decrease this oxidative stress. In terms of when you visit your physician, he's going to recommend to do an A1C to see how your blood sugar has looked so he can prevent your diabetes. By all means, get your A1C test. Now, here's an article from a journal that obviously from my group of periodontists across the country, the Journal of Periodontology, saying that gum disease leads to an entry of bacteria and germs into the bloodstream, thereby affecting the inflammation and the inflammatory response in that host, in that person. Significant risk for heart disease exists with gum disease. And given that 50% of Americans have gum disease, then the risk is so important, not just for smiles, but from a public health perspective in preventing diabetes and heart disease and helping to save a vast majority of our Americans. So what their conclusion was, and I'm blocking a little bit, is that treatment of your gum tissue leads to reduced inflammation and reducing subclinical heart disease. So you say, well, what can I do, Dr. Fialkoff? You can do plenty. You can brush twice a day with a soft brush and floss every night with whatever mint flavor, other flavor, waxed floss that you want. Why I say that is so it doesn't rip between your tissues. You don't have to use unwaxed floss. Waxed is fine. Get, make, and keep your appointments with your physician. Control your diabetes. Get your blood levels checked. See your dentist. Make sure he checks you for decay because fillings and poorly fitting crowns would lead to gum disease. See your periodontist or call us. We'll be happy to make sure that you stay healthy. If you wear dentures, take them out at night. When you take them out, clean them. Make sure you brush your tongue when you brush. And do this every day. Do it consistently. And over time, you will have a healthy, happy smile, and you'll avoid diabetes and gum disease. Now, sometimes your gum disease has gone too far. So what do? Well, something you can do if you don't let it go too severe is you can clean away the tartar, the mineral deposits, the bacterial deposits with deep cleanings, which we call scaling and root planing. This cleans them from underneath the gum tissues so your gums can return. Sometimes we get done with that, but you have areas where you need more. You need a little bit more. The bone has to be healed. The bone has to be regenerated with bone material, bone grafting material, special regenerative gels that I use. And so you need a little form of either laser surgery or regular surgery But this is on an outpatient basis with a little local Novocaine, and you continue with your work the next day. The main point is not to ignore it. And then once that's done, and this is in every field, it's almost like an exercise. If you don't exercise, you lose the game. And I can tell you that because I love exercise. Same thing with periodontal disease treatment and with health. You need to visit every 3 months. That's what I recommend. You're saying, well, my insurance pays every 6 months, Dr. Fialkoff. Well, is it really worth missing 2 times a year, developing gum disease, having inflammation in your body, having diabetes start in your body, not knowing if you have a heart problem when you already have a family history? I don't think so. I think there's certain things in life we want to save and, economize on. There's certain things in life we don't want to economize on. Let's not economize on our health. And I would recommend, if you're seeing your dentist, see them 4 times a year. If you're seeing your dentist and alternating with your periodontist, continue doing that. But make sure you see each one twice a year, so you're being seen every 3 months. Don't let your insurance dictate your health. Stay healthy. In fact, I think as time goes on and these studies become more known, probably the insurance industry, to save people from disease, will probably start paying for every 3 months, which is something that they should do. Because if you think about the incidence of heart disease and diabetes in our country, the amount of deaths that are caused, the amount of people in hospitals, the strokes that occur, the loss of loved ones, it's really important that we start taking a look at what we need to do to have healthy communities and to have a healthy American population. So we would be more than happy to see you. I'm sure your dentist would be more than happy to see you, so you don't develop these pictures that you see on the screen of puffy gums, receded gums, teeth that are shifting, sensitive, bad taste and breath, and really also your smile. When you have a smile like that, who wants to smile? But Buddha, if you give me the last slide, and on that last slide, that's the kind of smile that we want. A beautiful smile where you have confidence, where you are comfortable eating the foods that you want, where sweet foods that you want to eat once in a while, because who doesn't like a good dessert once in a while? So do I. They don't bother you when you eat. You can enjoy it. Your teeth aren't sensitive. You don't have teeth in your mouth that are shifting because you've lost your teeth and your dentures don't fit anymore because there's been so much bone loss. So what's the take-home message from our talk today? Control your gum disease. Control your dental decay. Brush twice a day. Floss once a day. See your dentist. Get a cleaning more often than you probably have gotten. See your physician. Make sure that you get your blood sugar checked, your A1C checked. Make sure you get your blood levels drawn. Make sure that everything is okay with your heart. If you have a genetic history, a family history of diabetes, of heart disease in your family, make sure you see your dentist. See us more frequently. And may you have a life that's healthy, happy, with a beautiful smile, with your confidence returned, and one day you think, I listened to that talk with Dr. Fialkoff one day, and I'm happy that I did. I hope it helps, and I want to wish you all a very good night from A Time for Truth show. We'll see you again next time.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. at your feet.